Hey there, it's Dr. Appalraju, and on today's post, I want to talk about smoking and how it's aging you. This will be particularly useful for young women or girls out there because that is a population where smoking has dramatically increased, especially in high school girls. So if you know anybody or have a teenage daughter in high school at that age where smoking could be a factor with all the social pressure, then maybe forward this on or get them to watch this. It might help them realize the downstream effects of smoking. And there are many. So one thing you could certainly do is just go onto Google, pause this video, go onto Google, or go right afterwards and type in smoking images of twins and see what shows up. You will find, if you look at those images, you're going to find people, twins, identical twins. One was a smoker and one was not. And you're going to see the difference just on their faces of what smoking can do. And it's a very simple way to get this image across. Now, what is smoking doing? Well, other than the higher risk of lung issues like emphysema and COPD, chronic obstructive pulmonary disease, and difficulties breathing and cancer and all this type of stuff, there are some specific things that women might be more, need to be aware of. And one of them is the changes in skin. So typically, women who smoke are going to have bags under their eye. They're going to always look tired. They tend to have these lip lines around their mouth from holding cigarettes in there. They tend to have crow's feet that are happening around the eyes, and those tend to develop earlier, and they tend to be much deeper than in people who don't smoke. They often have poor skin tone, uneven color, age spots, especially if you're smoking and also in the sun a lot. They tend to have psoriasis, which is these kind of thick patches of skin, and it develops in different areas, but typically around joints, so elbows and knees and this type of stuff. You also will find that you get saggy skin, and that happens not only in the face, but on the breast area and the arms. So this is because of destruction of collagen and elastin fibers, which keeps the skin looking young and firm. And what else is happening with smokers? Well, from a dental perspective, we see obviously stained teeth, bad breath, higher risk of gum disease, higher risk of tooth loss, and obvious things would be for some people that smoke a lot, especially, if you're smoking a pack a day or 2 or 3 packs, we tend to have stained fingers and fingernails. In men who smoke, their mustaches will turn color. Other things that can happen, we also find that people develop cataracts. So they get this cloudy areas in their lenses, they can't see properly. And another one that may not be desirable for young females over time is that they tend to get thinning of the hair, sometimes in dramatic cases, even complete hair loss. And there have been some studies in Taiwan that show male pattern balding increases significantly in Asian men who smoke. So what's the point? Well, don't smoke. If you want to look young and live a long, vital life, those are just some of the consequences of smoking per se. And they're not, what you would expect over time. And in our practice, we certainly have seen people quit smoking at different ages, sometimes multi-pack a year smokers. There's never too late to quit. If you've quit successfully, maybe drop a comment on what you did. If you found this useful, give me a like, appreciate the comments. And remember, you only have one life. So live it well. I hope you found that useful. Take care and stay well out there.